Hey everybody, Dan here with Pain Free You. Another question by request. Somebody was asking me, I think it was Facebook, can tooth pain be a mind-body condition? The answer is directly, yes, sometimes. Sometimes we do have legitimate dental problems, in which case we need to go see a dentist. But if they have done the evaluations, there's no cavities, there's no infections, the tooth is not broken or anything like that, and they're saying, nope, dental health is fine. Pain in the teeth can absolutely be caused by a brain perceiving danger, right? And so, yeah, sometimes. So what do? Go to the dentist, get checked out. But what else can happen is there's a lot of fear about the dentist, and in some cases the fear of the dentist, we get a treatment done, it can be a fairly stressful, traumatic experience, especially the more fearful you are of the dentist anytime we go. Can be a traumatic experience. And so what can happen, what I've seen happen often for group members, is that people will go to a dentist, they'll get the procedure done, they'll feel some discomfort afterwards. And in some cases, if they've got a highly vigilant brain, always looking out for danger, may start to question the dental visit and the dental procedure and say, should I hurt like this? And symptoms that might last a day or two, the soreness that we can sometimes have after a dental treatment, can turn into something longer term. And so people end up going back to the dentist and let's take a look at this, let's take a look at that. And I've even heard people who ended up, with this tooth pain that had no organic reason for it, getting teeth pulled and all sorts of stuff and not really getting a benefit. Now the area of their mouth hurts where the tooth was, but there's no tooth and the nerve is gone. So is it possible that mouth pain can be TMS, perceived danger pain? Absolutely. Because the brain is perceiving danger. We don't like dental appointments. We get dental work done. There's some discomfort. The fear and the attention and the belief that, oh no, what if they did something and hurt me? What if they touched a nerve? What if they did this? What if they did that? Fear and attention are the two fuel sources that can make symptoms persistent. Fear and attention equals chronic. So the best bet, if you're having a procedure done, trust it. The body heals. The mouth heals. And so if there's some soreness after a treatment, trust the body to heal. It will. Convincing yourself that the dentist botched something is adding fuel to the potential fire that may lead to chronic, persistent tooth, gum, or mouth pain. And some people with a condition called trigeminal neuralgia tell the story of how it began with dental work. And that's a common experience that I've heard more than once. But I'm here to tell you, even trigeminal neuralgia, which has a pretty rough reputation in the pain world, I've seen, I think I have at last count about 6 trigeminal neuralgia, typical, atypical, type 1, type 2, whatever it may be, at least 6 success stories for people that had been given this medical diagnosis of trigeminal neuralgia, easy for me to say, which is oftentimes blamed on dental work, or the trigeminal nerve is pinched or irritated or something. At least 6 people have gotten better. And that's in my small world. Like, I'm not talking about global. I'm talking about in my little small world of people who follow my work. I've got 6 success stories. I truly believe that regardless of what the doctors call it, tooth pain, trigeminal neuralgia, nerve pain, you name it, any type of symptom or pain throughout your body can be caused by brain perceiving danger. If the brain thinks you have a tooth problem, it's going to make it hurt, so that you go back to the dentist and make sure that you get it taken care of. So, is tooth pain a mind-body condition? Maybe. But if the dentist has looked at it and sees no reason for it organically, dentally, then yeah, most likely it is the brain perceiving danger, and that is the cause of the tooth pain, sometimes the mouth pain, the facial pain. It's all driven by fear. It's all driven by the belief that we've got a body problem. And if the brain believes or has been told consistently that the dentist messed something up, most likely they didn't. Sometimes they could. But, sorry, there's a spider crawling on my leg. That's what you get sitting out here under the trees. But if the brain believes that there's a problem physically in the mouth or the teeth, the gums or the face, it will turn on symptoms as if that is true. It's called predictive coding. If you believe something and expect something, the brain can create it out of thin air. So, set the expectation. If you got dental work to do, expect it to go well. There's tens of thousands, if not hundreds of thousands of dental appointments a day around the U.S. and globally. And the vast majority of them go well. So, trust it. Trust the body. Trust the dental work. Teach the brain. And you'll be all right. Love you, folks. Talk to you soon.